Hey y'all, happy Friday. Let's get right into it. Welcome to the Positive Brainwashing Podcast. I'm your host, Ann Dumornay. I'm your favorite Haitian American autism mom. You see it. If y'all don't know, I love the color burgundy. This is more like a wine red color. I'm not sure, but I love this top. You guys know I love a good like square neck or a crew neck. It's perfect for the mic. Got my little cute square earrings, which I wore last episode. It's been about a week, so let's get right into it. We are continuing our series on autoimmune diseases. And we are talking about today, we are going to be talking about alopecia. We're going to be talking about the different types. We're going to be talking about causes, risk factors. We're also going to be talking about diagnosis and treatment. I wanted to say this episode is inspired by Gina Turner, who is a model who was featured in the recent doc Dirty Rotten Scandals, the 2 parts that came on Wednesday night on E! And they are now available for purchase, episode or the entire season. I purchased the entire season of the America's Next Top Model, now streaming on Prime Video. Check it out. Her story is beautiful. She talks about overcoming the shame she had around her alopecia, healing and finding beauty in within her alopecia areata diagnosis. Gina Turner was from Cycle 24, which was in 2018 of America's Next Top Model. Let's get right into hair loss. And this article is from the Mayo Clinic. It was released last month. And again, this episode is in honor of Gina Turner. Follow her on all platforms, at Gina Turner. She is awesome. And she's such a great role model. And what I will spoil for you on the doc is that now she has twin daughters, and seeing her being a mom and, instilling confidence and beauty within her daughters is one of the most beautiful things to see. Very much full circle moment. So let's get right into it. Let's get into hair loss overview. Hair loss, also known as alopecia, can affect not just your scalp, but your entire body. It can be temporary or permanent. It can result in hereditary or hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head, but it's most common in men. I didn't know that. Baldness typically refers to excessive hair loss from the scalp. Hereditary hair loss with age is the most common cause of baldness. Some people prefer to let their hair loss run its course untreated and unhidden. Others may cover it up with hairstyles, makeup, hats, scarves, even wigs. And still others choose one of the treatments available to prevent further hair loss or restore growth. Before pursuing hair loss treatment, talk to your doctor about the cause of hair loss and treatment options. All right, let's talk about the different types of baldness. We have male pattern baldness, female pattern baldness, patchy hair loss, which is called alopecia areata, which is what Gina Turner has. We also have traction alopecia, which I have from my mom braiding my hair too tight. It has grown back in. There's something called postpartum traction alopecia, which you can get and when your estrogen levels are so high, it causes you to lose your edges, but they do grow back. No worries, ladies. And then we also have frontal fibrosing alopecia. Let's get right into the different types. All right. Hair loss can appear in many different ways depending on what's causing it. It can come on suddenly or gradually and affect not just your scalp, but your whole entire body. Let's talk about the signs and symptoms of hair loss. There's gradual thinning on the top of the head. This is the most common type of hair loss affecting people as they age. In men, hair often begins to recede at the hairline from the forehead. Women typically have broadening of the hair part in their hair. Okay. An increasingly common hair loss pattern in older women is a receding hairline called frontal fibrosing alopecia. Circular or patchy bald spots. Some people lose their hair in a circular or patchy bald spots on the scalp, beard, or eyebrows. I have seen some people with alopecia who have no eyebrows. Because it's not just, hair loss on your head. It could be on other parts of the body. Your skin may become itchy or painful before the hair falls out. Sudden loosening of hair. A physical or emotional shock can cause hair to loosen. Handfuls of hair may come out while combing or washing your hair, or even after gentle tugging. This type of hair loss usually causes overall hair thinning, but it's temporary. There's full body hair loss as well. Some conditions and medical treatments, such as chemotherapy for cancer, can result in the loss of hair all over your body. The hair usually grows back, after, the treatment of chemotherapy. All right, patches of scaling that spread over the scalp. This is a sign of ringworm. It may be accompanied by broken hair, redness, swelling, and at times oozing. When to see a doctor? This is such a great question. Let's get into it. See your doctor if you're distressed by persistent hair loss in you or your child and want to pursue treatment. For women who are experiencing a receding hair loss, also known as frontal fibrosing alopecia, talk to your doctor about early treatment to avoid significant permanent baldness. Also, talk to your doctor if you notice sudden or patchy hair loss or more than usual hair loss when combing or washing your hair or your child's hair. Sudden hair loss can signal an underlying medical condition that requires treatment. Let's get into the causes, all right? People lose 50 to 100 hair strands a day. That's good information. I never knew that. This usually isn't noticeable because new hair is growing in at the same time. Hair loss occurs when new hair doesn't replace. Oh, okay. Hair loss occurs when new hair doesn't replace the hair that has fallen out. That makes sense. Hair loss is typically related to one or more of the following factors. First, a family history, or a hereditary, or otherwise known as genetics. All right. The most common cause of hair loss is a hereditary condition that happens with aging. This condition is called androgenic alopecia, also known as male pattern baldness or female pattern baldness. I've always known about male pattern baldness. I didn't know that it can happen in women as well, but that's genetic for you. It usually occurs gradually and predictable patterns. And in predictable patterns, a receding hairline and bald spots in men, and thinning hair along the crown of the scalp in women. Hormonal changes and medical conditions. This part is very important. Ladies, pay attention. A variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, which I talked to you guys, for example, the postpartum alopecia. That's an example, during or after pregnancy, childbirth, menopause, or thyroid problems. Medical conditions include alopecia areata, which is an immune system related. Again, it is an autoimmune disease, alopecia, right? So it's basically when the hair cells attack each other, which causes the hair loss, right? All right, which is an immune system related and causes patchy hair loss, scalp infections such as ringworm, and hair pulling disorder called trichomania, right? So there are some people who have trichomania. They basically pull out their hair from stress. There's also another thing called trichophagia, people who have this condition that they eat their hair also, I think, is stress induced. I'm talking about different types of eating disorders, and trichophagia was one of them. So check out that episode. All right. Medications and supplements. Hair loss can be a side effect of certain drugs, such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. Ooh, I didn't know that. I have to check out. I take high blood pressure medications. And my hair is growing in fine, but always check the side effects of medication. This is just a great reminder. A radiation therapy to the head. The hair may not grow back the same as it was before. A very stressful event. Many people experience a general thinning of hair several months after a physical or emotional shock. This can happen from trauma. So I'm glad they brought this up. This type of hair loss, again, is temporary. Hairstyles and treatments. Excessive hairstyling or hairstylists that pull their hair back, such as pigtails or cornrows, can cause a type of hair loss called traction alopecia. I believe that's how I got my traction alopecia. So growing up, my mom would braid too tight. Like, for example, the African braid too tight. And if you pull your hair back too much, you have it in a bun too much, don't do it for too long. I definitely do. This is why sometimes I put hair bands and have my hair out. That way I can have my hair out. I'm not getting too much traction. And I can have my hair away from my face because I like to be able to work and read. Right? So don't put your hair up too much or too tight. No tight braiding hairstyles. Be careful with that. There's sometimes hot oil treatments and permanents. And perms that can also cause hair to fall out. If scarring occurs, hair loss could be permanent. Guys, for example, I remember having horrible scalp burns when I used to perm my hair, which is one of the reasons why I went natural, to make sure my hair was healthier. I've had my hair in the locks now for 3 years, and my hair has never been healthier because it's a protective style. It's there, it's growing, it's very low maintenance. As long as you're making sure you're getting your wheat twist every, for me, 6 to 8 weeks, make sure you're taking care of your hair. Self-care matters for all parts of the body. But hair, especially for women, it's like a crown. It's like an accessory, so it's important to take care of your hair. Let's get into risk factors. A number of risk factors can increase your risk of hair loss. That includes, again, family history of balding on your mother's or your father's side, age, significant weight loss. Oh, that is important. Certain medical conditions such as diabetes or lupus. Again, we're going to talk about lupus next week because, again, what is it? An autoimmune disease, right? So autoimmune basically means when the immune system or a certain part of the body, for alopecia, it's in the hair, it attacks itself, which causes loss, right? There's stress and also poor nutrition. Make sure you're eating healthy. Everything you eat just doesn't cause you to be healthy on the inside of your body. It causes health on the outside of your body. And that's vitamins for hair, skin, and nails, examples like that. All right, let's get into prevention. All right. Most baldness can be caused by genetics, male pattern baldness and female pattern baldness. This type of hair loss is not preventable because there's nothing you can do with DNA. That's just one thing that can never be changed. But there are ways to treat it, and we're going to talk about that a little later. These tips may help you avoid preventable types of hair loss. Be gentle with your hair. Use a detangler and avoid tugging with brushing or combing, especially when your hair is wet. A wide tooth comb, which helped me a lot before I locked my hair, might help to prevent pulling out hair. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatments, or perms. Limit the tension on hairstyles that use rubber bands, barrettes, and braids, right? Make sure you're not getting tight hairstyles because that will cause traction alopecia. Ask your doctor about medications and supplements you can take that might help hair loss. Again, think about taking, and these are over-the-counter vitamins you can take for hair, skin, nails. I've taken them in the past. They're great. Try them out. Protect your hair from sunlight and other sources of ultraviolet light, also known as UV rays. Stop smoking. Some studies show that the association between smoking and the association between smoking and baldness in men. A lot of these things that we study together seems like smoking is always a risk factor. So pay attention to that, guys. If you can avoid it, don't smoke. And if you do have trouble smoking, look into some resources that will help you quit, such as the patches. I know there's like gum. There's certain things that you can do. Even hypnotherapy. I mean, like if you're open to it, it does help in certain addictions. If you're being treated with chemotherapy, ask your doctor about a cooling cap. This can reduce the risk of losing hair during chemotherapy. All right, y'all, let's get right into, again, this is really recent. This article from, you guys know I love a good Mayo Clinic article, and oh, don't worry, the link will always be available in the show notes of all the podcasts across all the platforms. Let's get right into diagnosis and treatment. How do you diagnose alopecia? First up, diagnosis, right? Before making a diagnosis, your doctor is likely to give you a physical advance and ask you about your diet, which is what you eat, your hair care routine, your medical and family history. You might also get tests such as the following: blood tests. This might help uncover medical conditions that can cause the hair loss. Pull test. Your doctor gently pulls several dozen hair strands to see how many come out. This may determine the stage of the shedding process. Oh, I've never heard about that. A scalp biopsy. I've actually witnessed one of those, and it's pretty gnarly. Your doctor scrapes. I was a medical assistant, you guys don't know, and I've assisted doctors in a scalp biopsy before. Your doctor scrapes samples of the skin or a few hairs plucked from the scalp to examine the hair roots under a microscope. This can help determine whether there's an infection that is possibly causing the hair loss. And there's also light microscopy. The doctor uses a special instrument to examine hairs trimmed at their bases. Microscopy helps to uncover possible disorders of the hair shaft. Let's talk about treatment. Okay, effective treatments for some types of hair loss are available. You might be able to reverse hair loss or at least slow it down with some conditions such as patchy hair loss, also known as alopecia areata. Hair may regrow without treatment within the year. Treatments for hair loss include medications and surgery. Let's get into some medical treatments for hair loss. If your hair loss is caused by an underlying disease, treatment for that disease will be necessary. If a certain condition is causing the hair loss, your doctor may advise you to stop using it for a few months. All right. Medications are available to treat pattern or hereditary baldness that affects male and females, which I just learned today that affects females. The most common types of medications are minoxidil. This one is an over-the-counter, non-prescriptive one. It comes in liquid form. It also comes in foam or shampoo forms. To be most effective, apply the product to the scalp once daily for women and twice daily for men. Many people prefer the foam applied when the hair is wet. What the product does, it helps people to regrow the hair or slow the rate of the hair loss or both. It'll take at least 6 months of the treatment to prevent further hair loss and to start hair regrowth. It may take a few months to tell whether the treatment is working for you. If it is helping you, you'll need to continue using the medicine indefinitely to retain the benefits. Possible side effects include scalp irritation and unwanted hair growth on the adjacent skin of the face and hands. Another medication is called finasteride, also known as Propecia. This prescription is a drug for men. You could take it daily as a pill. Many men take the fina, finasteride. Finasteride, yep. Experience it slows down the hair loss, and some may show new hair growth. It may take a few months to tell whether it's working for you. You'll need to keep taking it to retain any benefits. Uh, Finasteride may not work as well for men over 60 years old. Rare side effects of finasteride include diminished sex drive, hair and sex drive. That's interesting. Sexual function, which does that mean it can cause ED, erectile dysfunction? If you know, you know. And an increased risk of prostate cancer. Is it even worth it at this point? These are some really harsh side effects. Women who are or may be pregnant need to avoid touching crushed or broken tablets. All right. Other oral medications options include Carosphere, al- alloDactone, or an oral dutastride known as Avodart. Another thing that is getting wildly popular is called the hair transplant surgery. A lot of men have been getting it in Turkey. For example, there was a contestant named Timmy who was on Love is Blind who got a hair transplant. I know this really great writer who recently got a hair transplant, and it really works. All right. And the most common type of permanent hair loss, only the top of the head is affected. A hair transplant or restoration surgery can make most of the hair can make most of the hair you have left. During the hair transplant procedure, a dermatologist or a cosmetic surgeon removes hair from a part of the head that has hair and transplants it to a bald spot. Each patch of the hair has one of the several hairs, micrografts or mini grafts. Sometimes, this is interesting, and I guess to learn this with you guys. Sometimes a larger strip of the skin containing multiple hair groupings is taken. This procedure doesn't require hospitalization, but it is painful, so you will be given a sedation medication to ease any discomfort. Possible risks include bleeding, bruising, swelling, and infection. You may need more than one surgery to get the effect you want. Hereditary hair loss will eventually progress despite the surgery. So if it's hereditary, the insurance might not. I mean, I'm sorry, I'm reading something else. The surgery might not be as effective. That's interesting. All right. Surgical procedures to treat baldness are not usually covered by insurance. Again, it is an elective or cosmetic surgery, so I'm not surprised that insurance doesn't cover it. Lastly, is laser therapy. The Food and Drug Administration, also known as the FDA, has approved a low-level laser device as a treatment for hereditary hair loss in men or women. That's again the male or the female pattern baldness. A few small studies have shown that it improves hair density. Most studies are needed to show the long-term effects. There's also clinical trials, guys. That's not the end of the article, so my bad. We're going to continue for a little bit. Whew. Testing new treatments, interventions, and tests as a means to prevent, detect, or treat or manage this condition. All right. If you guys are into anything experimental, there's nothing wrong with trying some clinical trials. There's also lifestyle and home remedies that may work for those of you who want to take a natural route. You might want to try various hair care methods to find the one, excuse me, to find the one that makes you feel better about how you look. For example, using styling products that add volume, color your hair, which means dyeing your hair if you so choose. Again, even how your hair grays. A lot of myths have been said that your hair graying is about stress. No, it's actually based on your genes. It's hereditary. So in my father's family, by 40, everybody turns gray. By the time I was in my late 20s, I already found a gray hair. I'm 30 now, so we'll see how things happen. But I have decided to go gray naturally. So if you see the gray start growing in my life by the time I'm 40, I warned you guys. All right. Choose a hairstyle that makes a widening part less noticeable. Use wigs or extensions or shave your head. Talk to a hair stylist for ideas. These approaches can be used to address permanent or temporary hair loss. If your hair loss is due to a medical condition, the cost of a wig might be covered by insurance. I do know that I think for some cancer patients, wigs can maybe be covered by insurance to help while you're in treatment. All right, preparing for your appointment. You're likely to first bring your concerns to the attention of your family doctor. He or she may refer you to someone who specializes in treatment of skin problems, which is dermatology. For some of y'all, you may not realize your scalp is actually part of your skin, which is why they're referring you to a dermatologist. So out of the scalp, which is the skin, grows out your hair. And underneath that is the blood supply for the hair, for those of you who don't know. All right, let's continue. Yep. What can you do? List key personal information, including major stresses or recent life changes. Make a list of all the medications that you take. That includes vitamins and supplements that you're taking or any over-the-counter medications. All of that helps your doctor to find the best treatment for you, and list the questions that you may ask. Your time with your doctor is limited, so preparing a list of questions will help you to make the most of your time together. List your questions from the most important to the least important in case time runs out. For hair loss, some of the basic questions you want to ask your doctor is, what is causing my hair loss? Are there any other causes? What are the kinds of tests do I need? Is my hair loss permanent or will it grow back? How long will it take? Will it have a different texture after it grows back? These are some really good questions. Shout out to Mayo Clinic for this. What is the best course of action? Should I change my diet or haircare routine? Like, what you eat does affect your hair growth. All types of growth in the body. Just think about that. Are there any restrictions that I need to follow? Should I see a specialist like a dermatologist? What will it cost me, and will my insurance cover seeing a specialist? Another great question. Is there a generic alternative to the medication you're prescribing me? Because oftentimes, if you're paying out of pocket, the generic ones cost less. Do you have any brochures or any printed material that I can take home with me? This is called patient education, which we used to offer in the office when I was a medical assistant. What websites do you recommend? And here's what, as the patient, you can expect from your doctor. And this is the final section. Your doctor is likely to ask you a number of questions. Being ready to answer the questions may reserve time to go over any points you want to spend more time on. Your doctor may ask, when was the first time you experienced hair loss? Has your hair loss been continuous or occasional? Have you noticed poor hair growth, hair breakage, or hair shedding? Have your hair loss been patchy or overall? So patchy means, are there certain spots of baldness, or is it overall baldness throughout the hair? Just for more clarification. Have you had similar problems in the past? Has anyone in your immediate family experienced hair loss? But then again, genetics, hereditary, if it's hereditary, plays a big role in your male or female pattern baldness being the reason why you have it in the first place. What medications what medications or supplements, those are over-the-counter medications or even the natural medications, those that are not regulated by the FDA, that you're taking regularly, because those a side effect can be that it's causing you problems with hair loss. What, if anything, improves the hair loss? And what, if anything, appears to worsen the hair loss? These are important questions. All right, y'all. Thank you so much for listening. Come back next week. We're continuing our how do I say this? We are continuing our series on autoimmune disease, and next week we'll be talking about alopecia. The following week we're going to end our series on autoimmune disease by discussing the fibromyalgia, which is very important for women. So stay tuned for that. Remember to follow me on IG and TikTok at the Positive Brainwashing Pod. If you have any questions, comments, concerns, go ahead and email me at thepositivebrainwashingpod@gmail.com. All this information will be located in the show notes across all the platforms. Remember, the podcast is available audio and video on Spotify. I'm also available audio only on Apple Podcasts. Please rate and review. Amazon Music, Audible, iHeartRadio, and Pandora. Again, I am new to iHeart, so I am working on that platform. You can get it audio only. Please follow everywhere. Tell a friend to tell a friend. Go ahead and over on Spotify, give me a 5-star rating on YouTube. Shout out to my subscribers. I'm so excited to see the numbers growing. So like, comment, share, and subscribe. Share the video. Share this knowledge if you so choose. Over on Spotify, go ahead and share the episode in your stories if you can. Give me a 5-star rating. Go ahead and leave any comments and questions and concerns. I am here for y'all. What else is going on? Follow my content. I do all things entertainment. So over on my page at AC Do Morning on TikTok and Instagram, that is ACDUMORNAY. You could also follow me on Facebook. Again, everything I say here will be located in the show notes, so don't worry about that. And all links will be provided to the article. And so follow me on Facebook at Andumornay. That is ANNE, last name DUMORNAY. And I do all things entertainment. You could come to me for all things TV shows, movies, books. That includes Audibles because I'm a big fan of Audible. I have an Audible account. Yeah, so TV, movies, Audible, books, music, all of that. I got y'all. And of course, podcasts. I'm a podcaster. I love listening to podcasts. I like to watch podcasts on YouTube. So yeah, I got y'all. All right, y'all. This concludes the episode. Have a great weekend. I'll see you back here next week. And no bonus episodes for the time being because I have some deep dive docs that will be coming out soon. So stay tuned for that. Have a great weekend. All right. Peace.